the students of the International European University. Today I would like to, with great honor and pleasure, I would like to introduce you outstanding pastor in Ukrainian medicine, surgeon Dr.
Valikhnovski, yes.
Dr. Valikhnovski made a great progress in this period of time. You know, after Soviet times, they finished, and Ukraine challenged a lot of problems. So, and medicine is the best. And it were need new approaches. We needed new approaches, how to solve a lot of problems in the country in the sphere of healthcare. And Dr. Valikhnovski, he was and he is the best who do this work, who did it. And that's why we have invited Dr. Valikhnovski today here to share his own experience, his view on medicine and healthcare, on surgery, and that's why the floor is given to you, dear doctor.
Thank you so much, dear friends, for your time and intensity with your education. I would like to ask some questions to you in order to know what will be the most fruitful scenario of our communication, okay? From which countries you have come from, please? From Europe, from Middle East, from Asia, from Africa? Pakistan, yes. Pakistan, yes. This team on the left side, from which countries? Nigeria. Ghana. Liberia. Wonderful country. Yes. And from Europe, we have somebody from Europe here. Why Ukrainian people are keeping silence? Why you are in silence, please? From which city you have come from Ukraine? Kyiv? Novovolynsk, Volynsk region, very good. Zaporizhia, very good city on the Dnipro river. Other cities? Okay, who is so strong and brave to become surgeon? Raise your hands. So what is the percentage? Let's count. What is the percentage? 40% of persons, yes, 40, 50. It's a lot, yes? Why do you want to become the surgeons? Tell me, yes, tell us.
Well, I want to do neurosurgery.
Neurosurgery.
So the brain and the spine are like interesting to me because you can never get into depth with it. Like, it just keeps improving all the time.
Yes. What kind of problems you can solve with your profession to your patients?
Well, a lot of patients will be coming from car accidents, or just people with brain tumors or
Yes.
hemorrhages on the spine.
Mm-hmm.
So I'll basically be improving lives by,
Mm-hmm.
for example, if someone had an operation before and had, what do they call it? Like, bad experience. You know, sometimes that's
Okay. How long you should be taught it by? You should be taught by your professors here to become neurosurgeon.
It's 5 years of medical school plus 7 years of internship.
Very good answer. Can you imagine that this time period can be decreased or minimized to 4-5 years?
I can't imagine.
You can't imagine. Okay. It's possible. I will show you how in this lecture. I have some slides prepared for you, for your attention, in order to make an accent on this topic. Yes, how we can be more strong in our education. How we can be good in our memory in the question of last longing memory in accordance to your theoretical and practical knowledge. How come you can be ready to start or to rush into your practice just after finishing your medical school. Interesting. So let's go. This is the first slide. Why me? Why me? I'm here. Maybe because I don't only have the chance to talk theoretically, but I do have practical results. Thanks God, I was the personal, and I am the personal doctor and surgeon of my president, Mr. Yushchenko, who will be met by you in 5, 10, 15 minutes. 1 hour he will be here in your university. Our president, most powerful president of Ukraine. He was poisoned drastically by dioxin, and he has been poisoned by almost the highest dosage of this dioxin, and he survived by the efforts of international team, surgeons and dermatologists from Switzerland and from Ukraine. I'm proud of it, because this is my favorite Ukrainian president. He is very good friend, and he is friend not only to me, but to all Ukrainians and many, many foreigners. He is friends from all over the world. The second motivation and explanation is that to my team, not only me is operating, I have in my team 9 professors, despite me personally. So in our clinic, there was a team of Discovery Channel. Discovery Channel has a program Bizarre Bodies. The audience of this TV channel, this is medical, surgical project, 2 billion people. 2 billion. How much populations do we have on our global? 7. So 2 of 7. It's not small quantity, yes? So I'm proud of it, because that was the first case in our history, in the history of our healthcare system in Ukraine, to show up the work of Ukrainian surgeons to such a big audience. We've done the surgical treatment to very rare inborn defect, rare diagnosis. I will show you this in my website. You will see all the peculiarities, how to work with this British channel and this brilliant team of professionals. And the third motivation, we work on a yearly basis with American team from Boston, from Harvard Medical School. We are giving on humanitarian basis the service to our young and small children, Ukrainian children from 1 month's age and older, with maxillofacial deformities. Cleft lip, cleft palate. This is very often deformity to children, to child persons and patients. So we do these operations to our small Ukrainians to help them be better as functionally, so aesthetically. So we'll go in our journey. Here you see some facts. I'll tell you different countries. Do you know that in Australia, this is the highest rates, Australia has the highest rates in the world to perform surgeries in the world. So most often operations and the surgeries performed in life of Australians, most often comparing to other nations and countries. Australia, number 1 to love surgeons and their work. Pakistan. Pakistan has, from Pakistan, yes? So, dear friends, 2,000 renal transplants are performed annually with 75% on foreigners. I cannot show you with later because it's not working here, there. So I'm using my hand, sorry. I can give this pencil to show you more, some peculiarities. USA, cataract surgery is the most common procedure in the USA. So, most popular surgeons in USA are ophthalmologists. Number 1 surgeons in United States. 3 million cases per year. South Africa. Do we have somebody from South Africa here? You are from South Africa. Elon Musk is from South Africa. Yes, we'll talk about him today too. So they do also very effective surgical error. You know, the set reason for American patients to die is medical risk and doctor's mistake. Set reason to die. So there is very high morbidity and mortality connected to this reason. So what are the most popular or most often surgical errors in the of American operating on the wrong patient? Yes. Can you hear me properly? Yes, the microphone is working. The second, leaving a surgical equipment behind, so some instruments are left inside of body cavities, such as abdominal cavity, pelvic cavity, and even the brain. Can you imagine that? Operating on the wrong side of a patient. Patient is coming, for example, for kidney resection or amputation, removal, and suddenly, all of a sudden, patient is awakened from the anesthesia. The lawyer is coming and telling him, your right kidney was removed. He says, no, I'm diseased only on the left kidney. When someone is working in anatomically difficult conditions, he can traumatize some anatomical sites, such as aorta, such as carotid artery, such as brachial plexus, such as ophthalmic nerve, and in accordance and in complete dependence to this trauma, this patient will be traumatized. He will be victim of medical surgical procedure. This is drama. To get informed, coming to surgeons, he signs some law documents explaining all the peculiarities of operation, all the details of anesthesia. Doctor is explaining everything to the patient. But maybe in some situations, the patient doesn't understand the value of all these meanings. The doctor is explaining quietly, politely, in way. My microphone is working or is not working because it's switching to operative mode or not operative mode. So guys, please check it, please. Okay. So did you know that in South Korea, the capital of plastic surgery in the world? So they do 20 procedures per 1,000 people. Korea, plastic surgeons in the world. Because this screen is on a very high distance from your place where you're sitting, yes? So I asked the authorities to put very big screen on the whole wall. Using this projector, next time we'll see more these digits. Sorry. Should explain something. I can see this, you cannot see. So I will send you all this to your email. So only 1% of people remain conscious during an operation where general anesthesia was provided. 1%. Only in the brackets, because it's too high. 1 per 100 remains conscious. You remember this movie, Hollywood, anesthesia, narcosis. Remember, somebody can find it in YouTube channel. So the guy who was in this anesthesia was he was to everything. Again, it's not working. Sorry. I should be more loud. And, sorry. We can move. What is the longest surgery in the history of surgery? What is the duration of that surgery? How many hours? How many days? Huh? Tell me louder. Yes. 4 days. 4 days. Can you imagine? 4 days. The duration for in the history. General Hospital. The surgery that joint twins, two twins, Siam twins. They have been connected and they have been separated. What are the risks of the patient to die? Doctor's mistake. 1 in 10. Your chance of being subject to error in hospital. 1 in 10. Highest risk. The risk to be traumatized in car accident or victim of aircraft accident is lower. Yes? Your chances of dying error in healthcare is 100. The chance to die during surgical procedure is 1 in 300. You can see the surgeon Robert Liston. He was doing all the operations very quickly. What was the duration of his? How many minutes? 5 minutes, as our Pirogo, Ukrainian surgeon. Why? What is the reason? Tell me. That was the time when the anesthesia was absent. So the patient during these 3-5 minutes did not have the chance to be in shock, pain shock. So they have been using some procedures, Rausch narcosis, when the conscious was absent for 3-5 minutes, and in this time space, surgeon should have been doing all the operations. Can you imagine 3-5 minutes? Appendectomy, 3-5 minutes. Tumor removal, 3-5 minutes. Amputation, 3-5 minutes. We remember our Ukrainian surgeon, Pirogo, during Crimea war on our Black Sea. He Zero World War, so-called zero. The time 1993 and years, when this war was unsafe settings. Yes, different statistics, different digits. Road traffic accidents kill more people each year than malaria. Africa in 100. But as few as 1.6% of women in Africa are able to. So the access to this service is very low in West Africa. At least 70,000 operating theaters worldwide are performing surgery without no pulse oximeter. Every year. So there is technique supporting to check the functionality of cardiovascular system, how it's working. Equipment in some countries. About British healthcare, the necessity of good feeding and nutrition before the operation. You can find very good uses presentation to your email boxes. Historical timeline of surgery was developed. How regional different operations they have in the historical time have when a heart transplant was done. Yes, what was the survival of this patient? This is very interesting. It can be this historical period. Very good surgeons knowing about data statistics that was in the past, but that statistic you can be very effective in our practice, looking very strictly and directly to the future. What is it? Da Vinci system, yes. This is in time of and in time of these genius surgical teams we have now in our planet, on our planet. Now we've seen this difficult clinical diagnosis, operating urology patients, gynecology patients, oncological the eye of this system is much more precise than our human eye. 10,000 more discretion and precision is better than human eye. So a robotic system views the operative field much more effectively to look all the details of a patient's anatomy in order to see every vessel, every nerve, every cubic centimeter and millimeter of this surgical wound. So, surgeon is sitting there on the table, patient is here, a robot system is guided by his hands, and of course the other team members can view the wound, what is happening here, in order to see the operation from the very beginning to the very end. Here there is augmented reality, the simulator helping this future surgeon to be so meticulous in his profession that she will be operating much more effectively comparing to the surgeon's physical education. You'll see this very company also VR. They are leaders on the market in virtual reality training for surgeons. Here is the reality training. Yes? We see time and motion handling, instruments, flow of operation and forward planning, knowledge of specific procedure and total. Ага, давайте. Can I will change the microphone. Sorry, thank you. Okay. Can you hear me? No? So? Okay. Thank you. And you can see that this training performed in virtual reality is much more effective compared to standard training. They have been comparing the effectiveness and performance of surgeons doing tibial shaft fracture intramedullary nailing. So for trauma surgeons, some operations have been chosen, and one of them is putting this shaft, tibial shaft, into intramedullary space. You see the difference between VR training and traditional. So your next years will be filled with this knowledge and with this practice. You are very happy persons because you will have these models and these possibilities. When I was in that age, me personally, I didn't have such a possibility to be taught by such devices. Okay, extended reality. We have virtual reality. What is that? Artificial world fully immerses users into a digital environment. We are fully there. Augmented reality, blending virtual objects, holograms, into the real world. We work with holograms. And mixed reality. This plus this, and we have the result. Merging of virtual and real worlds. Virtual and real objects coexist in space and can interact in real time. This is a technology, yes? So application or practical side. We can see head-mounted display. We've seen this display on the head of this lady surgeon. And we can use smart glasses. We can applicate these devices and this technology to education and training. Yes? Second part of surgical life is pre-surgical planning and image-guided surgery. Image-guided surgery. I used to be to Basel, Switzerland, on the last World Congress of Surgeons, and there we've seen all these devices to be practically implicated in different hospitals of Western Europe and Middle Asia and Middle East and Africa too. So this technology will go through medical schools. You will see more information. You will be more practical because your neurons in the central brain will have the chance to formate synapses much more quickly. And that is a biochemical mechanism to form long-lasting memory. This is very important. Another topic for communication. Here we can see on this slide 10 uses of virtual reality in medicine. So, educational purposes, surgical training, dentistry. Stomatologists are very eager to implicate this technology in their life. We have operation planning and test runs, patient informing and consulting. We can put this helmet and these glasses on the patient's head to show him what type of operation he's going to go through. What type of experience before or post-operation he will meet. So when the patient will be informed properly, he will be not so afraid of this future procedure he or she should meet in the nearest future. Yes? So this is very good educational tool for the patients too. Again, helping patients with Alzheimer's. dealing with motor skill disorders, overcoming stress, fears and complexes, patient distraction, and healthy lifestyle promotion. Thank you for your attention. Thank you for your attention and your time. So we can talk about your interesting topics you will tell me, and you can answer and ask the questions in our discussion. So I will tell you, before you will ask the questions, I will tell you what we will do, because this is good presentation, good slides, it's everything interesting, but you will ask me what will be for me. I have come to Ukraine from such a long and big distances from other countries, what I will see here in Kyiv, in this university. So I'm very honored to propose you the surgical course for the third and fourth year students. They are sitting here in this room too. I hope, yes? You are from third and fourth course, yes? Who is from third course or fourth course, yes? Good. So your friends, your colleagues, you are from which courses? First, second? First, second. So you will meet me on the third and fourth year of education. So we will meet for our meeting. So what I propose for your university and your team, your professors, Professor Gennady Petrovich, he is a very good bottom friend of mine. We know each other almost for 20 years. And we are very happy to say that we can create better reality for you and for all this university, thanks God too. So you know about standards of education in the world. You know about system of nostrification to medical diplomas. You heard about USMLE and ECFMG system for United States medical education. It's the program or system which helps international doctors and students to pass all the exams to fulfill the requirements of American medical system, which is one of the best in the world. And that tests are accepted in other countries, such as Australia, New Zealand, and even Great Britain. We'll have a very short course, how to. You remember our first question, Dr. Neurosurgeon from South Africa. What is your name? Nice to meet you, Martin. So we will have at least 12 lectures covering all the material necessary to pass ECFMG USMLE tests, step 1, step 2, and step 3. In step 2 we have clinical skills assessment and clinical skill knowledge, clinical knowledge. So the first step 1, as in Ukraine, we will learn theoretical disciplines and topics and lessons covering biochemistry, anatomy, physiology in this quintessence scenario, in most important knowledge necessary to pass step 1 with higher rank in order to be certified by ECFMG in States. Of course, this is the choice of everybody. When somebody doesn't want to go through these exams, I will not persuade you. You should have the motivation to go there, to go to American hospitals, to Great Britain hospitals, to Western Europe hospitals, to see that standards in this education. We will learn the tests, but also we will learn the textbooks and short summaries from these textbooks in order to be ready to pass this test and these tests with high ranks. One lesson will be given to third year students, another one on the next day for fourth year students. We have very good office in the center of Kyiv, Pечерsk region, Drahomirova 16, the location of our conference room. We'll have there very good environment. We'll have not only knowledge and summary and all the electronic platform and printed platform to learn everything we'll talk about, but we'll have good friendly community and democratic community to have the next to have the most important goal to have this knowledge. I've passed these exams. I do know how to do this, and I will help you to go through this test too. This is very important. Another very important message I would like to emphasize today is that we have very innovative, most modern clinic in Ukraine. This is my clinic where Discovery was filming their project. And there were two Ukrainian presidents, despite Mr. Yushchenko, there was Mr. Zelensky too. We've operated there two Ukrainian ministries of health. They have been operating there. So they trust us. They trust to my team. And thanks God, we can ask you to come there, and there I can show you some practical skills, asking you to join and to assist my team and my colleagues and me personally during operations done to human patients as well as animal patients. So we have experimental laboratory operative department. So there we will film all the operations and we will translate these operations to internet, to our friends and colleagues in other universities. As a teacher and partner of European Medical Students Association, I have the certificate from them to make this and the possibility to give such lectures even to our colleagues from Western Europe too. Having in our experience and possibilities distant learning devices and distant learning platform. This is very good. So we have ESFMG, USMLE message for you. Yes, this is very good dessert at the end of our discussion. And second dessert, we have these practical skills where you can see the transplant of different organs, such as liver, such as kidney, such as heart, and such as lungs, and heart-lung complex. I think it will be very, very interesting, because I would say this is a very unique experience we can share with you too. Questions? Please. Yes. New Zealand too. I would say healthcare system, this is a bottom of such a ship, sea ship, where we are floating together. We are sailors there. So I would say that for doctors, for practical doctors, there is no matter and no difference between systems of these countries, because they are very alike. New Zealand, Australian, British, United States, very alike, very similar, very similar. For you personally and for your team from your motherland, for your colleagues from your motherland and students, very important to be competitive. To be competitive, you should be very effective theoretically, you should good knowledge, you should have good knowledge. You should be selecting priorities. You shouldn't learn everything totally. It's a practical case. This is very ineffective stratagema. Yes? Not effective strategy. You should prioritize your knowledge. You can learn and read about Marvin Minsky. He discovered mind maps and visual learning. When you use such a programs and mind maps or something similar to these programs, you can easily create your knowledge tree. You will listen, see, here in Ukraine. You will write everything, print on computer. You will connect some files, video files and visual files, photo files, photo documentary. And at the end of your education, you will have short summary of your education. You will not have such a necessity to start from the very beginning. When you will rush into the practical residency, for example, in surgery, you should know everything from the very first day. Basic values, yes, of all your 5 years education or 6 years education. And this problem is met by every student in the world, in Europe and in the world too. Because our memory cannot remember everything we have learned during these 5 or 6 years. That's why American medical students are much more free and much more fluent. They have the system which is repeating everything every year, every content and all content which was learned before on previous years. So what is the best main and method of memorizing? Repetition. You can repeat and repeat and repeat. Of course, education is different each year. It develops, it changes. But so what is main? 95% of information is the same. 5% is changing. So there is no such a risk that at the end of your education you will see completely different theoretical disciplines. They will be almost the same, because human body is almost the same. We are creature of God. We have been created by God. That's why we have the most brilliant, most unexplained by human words reality that we learn such a miracle creature as human body. So I would advise you to base your knowledge tree upon that system that is accepted in all the world. One of them is, of course, ECFMG, USMLE, step 1, step 2, step 3, yes? Or British systems, they have different abbreviations to say that they are similar to American system, yes, of nostrification, but they are almost the same, but American system is much more harder, and that system of tests is much more harder to pass, yes. And another case, and another value, another question is practical. I've seen my colleagues from states, they have come in their 40s. They say to me that they are only started to operate. They are only started to gain your surgical experience. In my hospital, I see students from Italy, Spain, from Denmark, from Latvia, from Estonia, from even Mexico, from Romania, from Turkey. They operate in my operative room on their 5th year of education. They are already operating. Of course, I am responsible under my license. I am sharing their risks. But during 1 year, they operate general surgery operations, reconstructive surgery, vascular surgery, venous surgery. Thank you for your question. I think the answer is almost right. Thank you. Yes, please. Please. Yes. Yes. Of course. So, as a general practitioner, tell me, you want to be a general practitioner or you want to become the general surgeon? General surgeon. So you'll have the time space 2-3 years in Ukraine or other country to become such a surgeon. In States, they have 5-year residence duration course. 5 years. In Ukraine, we have smaller duration. But during this time, you will become assistant, first doctor's assistant or first surgeon assistant, second surgeon assistant, and then you will be operating by yourself, having your teacher assisting you. So it's possible. The second question about retinoblastoma is this difficult clinical case. And of course, we see indirect facial deformities due to this primary diagnosis. And of course, this maxillofacial deformity can be reconstructed. We can do the reconstruction doing maxillofacial procedures, bone plasty, osteotomies, and metallo-osteosynthesis to facial bones, which are reconstructed during this stage of surgical recovery, because the first stage of operation is removal of this tumor, of course. But when the tumor is removed, the second question is how to reconstruct the neighborhood areas to the face. So they are reconstructed, of course, and they can be reconstructed. The level of recurrence to retinoblastoma is rather high, retinoblastoma. So when we see that there is no recurrence and we have the permission from oncologist, ophthalmo-oncologist, we can do this reconstruction, not earlier. Thank you. I would say thank you for question. My father is surgeon. He has 50 years experience. I was standing behind the walls of operative department in Feofania Hospital here in Kyiv when he has had the heart operations done for him. He has atrial flutter, and we've done intravascular operations to him, and we have removed this abnormal cardiac rhythm. He is healthy now. This is the heart of surgeon. Surgeon who has performed 15,000 operations. And when I was so young as you, I've been listening, I've been watching, and I've been participating in his operations to be even the pupil of middle school in Ukraine. Can you imagine that? So how come I couldn't be the surgeon in my future? This is the answer. Thank you for your question. Another question from this gentleman from Ukraine, please. From Novovolinsk, yes. I would say my Ukrainian healthcare system. You know why? Yes, more possibilities and more human attitude. Western healthcare system are good, but sometimes there are cases when patient is not at the center of this attention. You've listened today about different medical mistakes, everything else. When our surgeons or doctors are doing mistakes, they tell to the patients that we are with you. We are not called by our hearts and souls. We will help you to recover from this dramatic episode in your life. In Western hospitals, sometimes first persons to be met by patient is lawyer, not doctor. You can do conclusions by yourself. You are clever student and future doctor. Thank you. Thank you. Thank you so much.
I want to say, guys, that let me congratulate you on behalf of students.
Thank you.
Board of the university is having awarded the title of Doctor of this university. The procedure will take place in 1 hour here.
Thank you so much. Thank you so much, Gennady Petrovich, and thank you to all your team. Thank you, friends. Thank you. I wish you brilliant and good, effective education in this university, and I will do my best and my maximum to help you. Thank you. Спасибо. Ага, добренько, хорошо.